Stop. Please take your hand off your neck. If you saw a viral, instant blood pressure trick telling you to rub the side of your neck, I need you to hear this clearly. Do not try that at home, especially if you are over 60. Carotid sinus massage is a medical maneuver. In clinics, it is sometimes used for specific heart rhythm situations, and only after we consider contraindications and monitor the patient. In older adults, carotid artery disease is common, and unsupervised neck rubbing is not a safe DIY method. Now, the practical part. What can you do that is safer, evidence-based, and realistic at home? Two approaches have research support for lowering resting blood pressure in many adults: isometric exercise, or static holds, and inspiratory muscle strength training, IMST, breathing in against resistance. And I will show you simple versions with senior safety rules. First, one key concept. Blood pressure is not only stress. Relaxation can lower numbers briefly, but long-term control usually needs a plan. Medication, when indicated, plus lifestyle, physical activity, sleep, salt moderation, weight management, and follow-up. And if you suspect your pressure stays high at night or you have white coat readings, ask your clinician about 24-hour ambulatory blood pressure monitoring. It can show patterns like non-dipping or reverse dipping, but interpretation is individualized. Let's go to Technique 1, Hand Grip Towel Squeeze. You do not need a device. A rolled hand towel is fine. Safety setup first. Sit in a sturdy chair, feet flat, back supported. Keep breathing normally, no breath holding. If you feel dizzy, stop. Now the method. Roll a towel into a firm tube. Squeeze it at a firm handshake effort, not maximal. If you have arthritis or neuropathy, use a gentler squeeze. Hold for 30 to 60 seconds. Rest for 60 seconds. Repeat 4 times. Then switch hands and repeat. Do this 3 days per week. This is a time-efficient form of isometric training. In research, isometric exercise programs often reduce systolic blood pressure by several millimeters of mercury on average, sometimes in the range of high single digits, but results vary by person, baseline BP, and adherence. If your BP drops and you feel lightheaded, especially if you take antihypertensive medication, tell your clinician. That may be a sign your overall plan needs adjustment. Now to Technique 2, IMST Resistance Breathing. Now breathing carefully. The viral internet version is often take a deep breath. That can help you feel calmer. But IMST is different. It is breathing in against resistance, typically using a small handheld device. In a sham-controlled clinical trial, high-resistance IMST, about 30 resisted breaths per day for 6 weeks, reduced systolic blood pressure in adults with above normal BP. That is promising, but it is not a universal substitute for medication. If you have COPD, severe asthma, or you get dizzy easily, discuss this with your clinician before you start. If you do have an IMST device, here is the safe beginner structure. Sit down. Inhale against resistance for about 1 to 2 seconds. Exhale normally. Do 10 breaths, rest, then another 10, rest, then the final 10. That's 30 total. No breath holds, no forcing through symptoms. Technique 3, Wall Sit. Optional and mobility dependent.
This one is effective for some people, but it is not for everyone. Wall sits load the knees and can provoke pain in knee osteoarthritis. It can also cause dizziness when you stand up, so consider this optional. Safety setup. Do it near a sturdy chair so you can sit immediately. Wear non-slip shoes. Keep your room clear of obstacles. Stand up slowly afterward. Technique. Lean your back against a wall. Slide down only a little. Do not aim for a deep squat. Hold 10 to 20 seconds at first. Rest. Repeat 3 to 5 times. As you build tolerance over weeks, you can increase the hold time gradually. The goal is consistency without pain spikes or near fainting. If wall sits hurt your knees, skip them. Use the hand grip towel squeeze instead. Now, the most important safety rule, because this is where people get into trouble. Do not hold your breath. Do not hold your breath during any isometric hold. Breath holding, Valsalva, can spike blood pressure. Keep a steady rhythm. Inhale, exhale. And here are your stop rules. Stop and seek help if chest pain or chest pressure, severe shortness of breath, fainting or near fainting, new weakness, numbness, speech trouble, facial droop, sudden severe headache or vision changes. If any of those happen, stop immediately and seek urgent medical care. Let's make this practical. A simple weekly plan many older adults can tolerate after clinician clearance when needed. Option A, lowest barrier, towel squeeze isometrics, 3 days per week. Gentle walking or cycling, most days as tolerated. Strength and balance work, 2 days per week. Option B, add-on, IMST, 30 breaths per day, seated, if appropriate. And keep doing what guidelines consistently recommend. Take medicines as prescribed, measure BP correctly at home, and follow up. If you want one takeaway, it is this. Don't copy instant neck tricks. Choose safer, evidence-based habits you can repeat. I'm Professor Oleksiy Kalmykov. If you want, I can also provide a one-page on-screen checklist for safe home BP measurement and a beginner versus frail senior modification chart for these exercises. Share this with someone who has high blood pressure. Don't rub your neck. Use safe, structured methods and coordinate with your clinician.